In developing the 2024 American College of Rheumatology guidelines on screening, monitoring, and treatment of interstitial lung disease in people with systemic autoimmune rheumatic diseases, prioritizing patient values and preferences was critical, recognizing the importance in patient input, especially with multiple diseases and few randomized trials. We engaged 21 patients with conditions including systemic sclerosis, Sjogren's, rheumatoid arthritis, myositis, and overlap syndromes for a cross-sectional panel, facilitated by myself, Dr. Reza Mirza, and Dr. Marcy Bolster, who joins me here today, as well as Dr. Michael George.
Using qualitative analysis, 10 themes were revealed across categories of communication, screening, and monitoring, goals of treatment, and treatment-related adverse effects. Here are the themes. First, communication. Patients emphasized the importance of close communication between patient and rheumatologist, but also amongst all treatment team providers. Second, screening and monitoring. Patients highlighted the challenge in their own abilities to recognize ILD symptoms and suggested providers should elicit symptoms in a variety of ways. Patients should also be well informed of symptoms for self-monitoring. Patients generally favored screening over not, despite potential burdens and harms. Finally, patients truly appreciate monitoring data such as PFTs and CT scans to be better informed about their disease and its trajectory.
Third, goals of treatment. Patients prioritize survival over adverse effects concerns in the setting of severe life-threatening disease. After survival, quality of life was the next priority, with the goal of returning to work and everyday life functions. Finally, there was recognition that sometimes treatment can only achieve disease stabilization and a new normal emerges rather than full recovery. Finally, the last category relates to treatment side effects. Patients were willing to endure side effects if the treatment was effective and they felt well informed. Patients also noted willingness to accept side effects depended on disease severity and their comorbidities. Minimizing prednisone use was a high priority among patients. 3 patients went on to participate in the guideline voting panel, representing the voice of the 21-person patient panel. Recognizing the importance of patient views, the patient's input was elicited first, with each PICO question being addressed. Patient perspective, including values and preferences, played a critical role in shaping the ACR ILD guidelines to be published in 2024.